So what was just one highlight of the year for you? What did you, if you could say in one sentence what you brought back after spending a year on the Humphrey program, what would it be?
Um, Leadership. When I remember that one of the first sessions that we got was about leadership. And we got a question from that ladies asking us, when they talk about leadership, what is the first word that comes to your mind? And I was like, yes, the first word is power. And then all through the years, I've been through a lot. By the end of the fellowship, we got another session on leadership with another guy. And he asked, what do you think when you think about leadership? And I say, inspiration. And that had been a radical change from the way I was thinking about leadership when I came to the program and the way I was thinking about it when I was outgoing. And I think that changed a lot on how I build my team, how I can help them, I can coach them. I think the greatest takeaway is how I view leadership.
What gap have you filled now that you've gone back home to Togo?
The first gap I think I'm trying to fill is consistency and complementary across health programs we're building in the country. So you have the Global Fund that is coming to help to fight against HIV/AIDS. You have the Gavi Alliance that is coming to help you on immunization. You have the USAID that is coming to help in maternal and child health. But sometimes there are overlaps and there are waste. Sometimes you got into conflict. So what we're trying to do is to build complementarity across all those programs. That's the first thing, how you map all the interventions of those donors, partners, so that you can have a meaningful and consistent health system. That's the first thing we're trying to do. The second thing we're trying to do is to leverage internal resources. So because we're very dependent on external aid, so what we're trying to do is to boost two mechanisms, the first of which is national health insurance, so that we have to pool funding coming from taxes, coming to people's contribution, so that we can build a solid national health insurance. The second thing is public-private partnership, which is how we can leverage corporate social responsibility to get more resources internally so that we can sustain our health programs. That's what we're working on.
All of this was possible because of the Hubert H. Humphrey program. So tell us, you know, if Hubert Humphrey was here today and you had a chance to speak with him, what would you share with him? What would you tell him?
The first thing will be his legacy. Somebody says that is civil service. Civil service is, he has that idea of how you can put your effort for somebody else. Not for your growth, not for your development, your selfishness, but for people. And I think that is his legacy. It's about think about the others, not only about you. Our world is so selfish. They talk about personal development. Yeah, it's good, but you can be developing yourself when working for others. And if I work for you and you work for me, then we all working for each other. And I think that is his legacy. If you see the Peace Corps, if you see those things, you know that this guy has been trying all the time to teach us how to work for each other.
So you had a chance to be in Atlanta, which is a wonderful American city. What do you think you gave? What do you think Humphrey Fellows give to the city of Atlanta by living there?
Somebody told me that America has a chance and a doom. Why? because they are lucky to be traveling in 50 different countries without leaving their country. Because you have all those states, right? So when we come from our country, we bring our country to them, our culture, our way of seeing the world. So we bring them another point of view, chatting with them, our culture, our history, and we can bring the world to them. That was the first thing to do. The second thing is I volunteer a lot there with MedShare, pulling those drugs and sending them back. With Habitat for Humanity, we were on the roof building, and I was with the Red Cross. I'm a Red Cross volunteer, and I'm a monitor for first aids back in my country. So when I get to Atlanta, I joined the Red Cross there. And the last thing I can remember is that we've been to many places delivering speech. At the university first, we have the brown bags speech, and I have 3 times to deliver my speech. And then we have a community church where I went, the Presbyterian church, they invited us. We have a lot of time to exchange, to discuss with American people. And I think we all grow together on this sharing.
What is your job today?
My job is Chief Officer for Program and Health System Strengthening within the Global Fund Project Management Unit, which is in the Office of the Prime Minister. I'm in charge for planning of the grant use. I'm in charge for monitoring and evaluation of health interventions. That's what I'm doing right now.
Okay, last question, promise. So did you get a chance to meet Jimmy Carter?
Yes.
Tell us about meeting Jimmy Carter, because the Humphrey program wouldn't be in existence without Jimmy Carter.
Jimmy Carter. I met him 2 times. The first time was when he came for Emory University, and he had that speech. I was impressed by something. His convictions are so strong. This is a man that had dedicated his life for peace. He told us what he did when the embassy in Iran, and hearing him, you see that you should sell your conviction for anything. You need to build strong conviction, exactly like the image we have with the roots. And one thing that Africa lacks a lot is our roots had been completely destroyed, and we have no more roots. I think that one of the big challenges we will have in the coming year in Africa is to build our new roots so that we can face the challenges. And Jimmy Carter is somebody that can inspire us.
Thank you so much, Koffi.
My
It's
pleasure.
been a pleasure to meet
My
with you,
pleasure.
and it was wonderful.